On October 6, 2016, a couple brings their 10-year-old daughter into the emergency room, and she was very sick. Her feet were turned inwardly, and the little girl was crying, saying her whole body was in pain and her skin was burning. Her mother did not want the hospital to run any tests because she said she already knew what was going on with her daughter. She just needed a certain medicine. The mother was very demanding, and she told the doctors to give her ketamine right away, telling them they don't understand her medical condition and they just need to listen to her. It takes a lot of medication to control her pain, but the medicine that the mother was wanting her daughter to have received was a risk of heart failure and cardiac arrest. The nurses and doctors tried to explain to her that her daughter could die from this amount of medicine, but the mother didn't seem to be worried about that. So they started the daughter on a low dose of medicine that her parents said that she needed, but it just wasn't working. And they admitted the little girl in the hospital, and after days of no progress, the doctors wonder who is the one really sick here. And is this medical diagnosis they've never heard of before even real? The parents was telling the doctors it's because you're not giving her enough medicine. It has to be a higher dosage. And since the doctors weren't listening to the parents decided to take their daughter out of the hospital. So they thought. But the doctors noticed that they were giving their child 1,000 milligrams of medicine every single day. And so when the hospital looked at the little girl's chart, there was multiple doctors documenting Munchausen's by proxy, which is a form of child abuse when you lie about your child's medical health or exposing the child to unnecessary medical procedures to fulfill your own mental health issues. The hospital told them that they had to leave the hospital immediately because their child was in state custody due to over medicating and teaching their daughter how to fake her sickness. And the mother was actually the one that was sick because 3 months later, the mother committed suicide. Welcome back to another episode of Jazzyxcrime. This is the Take Care of Maya case. A firefighter named Jack, this is Jack, fell in love with a nurse named Beata. This is Beata. She was Poland and she moved to USA when she was 16 and faced challenges due to her not speaking English. She was very mentally strong and put herself through college and became a nurse despite her hard to understand accent. Jack and Beata got married and had problems conceiving a baby, but Beata was a fighter. She didn't give up until one day they got their miracle baby, and it was a baby girl. They named her Maya. And 2 years later, Cal, the little brother, was born without even trying. Why does that happen? That happened to me too. But anyways, raising their two beautiful children, they had a beautiful house in a nice, beautiful neighborhood, always on a beautiful vacation. And Jack was retired. So they were living a dream come true and truly felt blessed. And then one day, Maya got sick. So it was on 4th of July weekend of 2015. 10-year-old Maya and her younger brother Cal, they were playing outside with sparklers near their home in Venice, Florida, when Maya just had a severe asthma attack. So her mom, Beata, and dad, Jack, took Maya to the hospital. And when they got there, Maya started complaining of burning sensation in her legs and her feet. But there was no diagnosis. Within a few weeks, she could barely even walk because her feet turned inwardly. And she started to get lesions and her legs could no longer support her body. And then at nighttime, Beata could hear her daughter Maya cry from the bedroom on the other side of the house. Maya would feel very lethargic, having bad headaches and blurred vision. So Beata's very confused and she just wants to take her daughter's pain away. And it's just getting very frustrating that no one can give her answers as to why her daughter overnight is feeling like this. And she worked as a home care nurse and she's seen so many kinds of sufferings, but Maya's symptoms were nothing like she had ever seen before, or anybody for that matter, because everyone was confused and had no answers. So Beata and Jack took Maya to All Children's, but that staff was also unable to come up with a diagnosis. And doctors at yet another hospital thought that Maya's muscle weakness in her legs could be a side effect by an oral steroid that she had been prescribed for her asthma. Then one day, one of Beata's patients recommended that they go to a local anesthesiologist named Anthony Kirkpatrick, who ran a center in Tampa, and he specialized in CRPS. So, CRPS is a disorder that is very confusing because it's rare. It seems to begin after an injury, which causes chronic pain, sensitivity, stiffness, and it makes the muscle weak, and it could last for years. And according to Dr. Patrick, this is what Maya had, and he diagnosed her with CRPS at their very first visit. He also told her parents about a unique treatment that could bring her some relief. It was called ketamine infusions. So Dr. Kirkpatrick told Beata and Jack that CRPS patients typically have like elevated levels of amino acid glutamate, and that the ketamine treatments will stop the effects on the nervous system. So, in layman terms, it tries to stop the brain from giving false signals of extreme pain. But because of the magnitude of Maya's symptoms that she had advanced CRPS. So, it was actually going to take a little more treatment, like coma-induced treatment. They had to put her in a 5-day coma procedure where they're giving her the ketamine while she's in a coma using 50 times the typical dose. And it's only available in Mexico. And a doctor warned Beata and Jack that Maya could die from this. But this was their only option, Beata felt like, because what else are they supposed to do? Watch their daughter deteriorate? And so they agreed to go with the treatment only after spending days of researching it, though. And after research, they felt like this was the best option. They just desperately wanted to stop Maya's pain. So they flew to Mexico, and Maya was very nervous before the procedure. She kept asking her parents, was she going to wake up? This is a 10-year-old. Like, think about this. A 10-year-old is asking her mom, am I going to wake up after this? But Beata kept reminding her of how strong she was and affirming her with love and strength. And Beata also recorded and documented everything. But anyways, Maya was hallucinating during this procedure. She kept screaming monster. I mean, it was a 6 long day coma. She finally came out of it though, and she remembered everybody's name and was doing much better. And the pain was actually gone. So it was like a miracle. Over the next year, Beata and Jack took Maya for ketamine infusions every 3 to 4 weeks. But Dr. Kirkpatrick was charging $10,000 per 4 sessions, which was not covered by health insurance, by the way. But Beata worked extra shifts. She was going to take care of her baby. She worked extra shifts so they could cover it. They sold their rental property to cover the cost, and eventually they was like, okay, let's go back to the drawing board. They went to go see a second specialist called Dr. Hannah in Florida Spine Institute. He had much cheaper rates and was affordable. So after a year, Maya was still required to be in a wheelchair. However, the ketamine did lead to huge progress. And by huge progress, I mean Maya's feet straightened, the lesions were healed, her pain was now manageable. Like, what a relief. They felt so blessed, and they felt like, okay, that coma was worth it. Maya was now dancing, laughing, playing. She even went back to school. Beata and Jack was so blessed. Everything was slowly coming back together. So they thought. October 6, 2016, there was a Hurricane Matthew to be exact. And although it was too dangerous to go outside, Maya relapsed. And Beata and Jack was like, oh, I'm taking my baby to the emergency room. Every severe symptom came back. She was screaming and crying and begging for somebody to help her. And so they rushed her to the emergency room. And of course, no one knew what CRPS was. So Beata had to explain to them that all she needed was ketamine. But the doctors, their focus was more so on the amount of medicine that have been given to Maya in the past than it was them trying to help her. And they wanted to further investigate the safety of Maya. But Beata is like, let's get her taken care of and I'll explain stuff later. Beata's very direct, and she's a strong woman. She knew what her baby needed. She just wanted the pain to go away, and the doctors wanted to do things their way, of course. And Beata was like, I understand that, but you could go do that on them other patients because I got this one right here. And that was a red flag to the hospital. So the hospital asked Beata and Jack to leave because Maya was now a part of a state custody. And the hospital documented that Beata was controlling, demanding, and didn't want to cooperate with the doctors. The doctors also noticed that other hospitals have put in Maya's file, Munchausen's by proxy, and there was also documentation in the child abuse hotline. So Dr. Smith, who was a child abuse pediatrician, and she was also the one that told the parents they had to leave, she documented that Maya's pain was all in her head, and it was more of a psychological pain, and Beata was the one that had mental health issues. So Beata and Jack got a lawyer because how devastating. We've come this far. We made it. She's dancing. She's going back to school. We see the light through the tunnel. And here we are again, but even worse because the state is trying to take my suffering child away from the comfort of her mom. And we've already spent so much money on these procedures. Now we have to spend money on a lawyer because I'm going to fight this. I'm going to get my baby back. She needs me right now. Beata was very concerned how this would affect Maya's mental health, not being able to have the comfort of her parents around in the midst of her pain and suffering. And so the lawyer noticed there was a probable cause to investigate this case due to the amount of medicine and how many times they were doctor shopping, but because they were trying to figure out what was wrong with their daughter. But the lawyer was saying it was very good of Beata that she had documented everything and just to cooperate with Children's Services so Maya can come home right away. They would not let no one come and see her at the hospital until they went to court. And so now emotions are high because Jack and Beata have been through so much with this, Like I said, as soon as it gets better, it gets worse. And Beata is a very strong and direct woman, which can be offensive to nurses and doctors. So during all of this, Dr. Kirkpatrick, he sees what's going on and he's like, oh, this is going to be an easy fix. I'm going to call the hospital, speak to the doctor and let them know. And so that's what he did. He called and talked to Dr. Smith, who was the one that documented that this was all a made up disease. Dr. Kirkpatrick told her, I am the one that diagnosed her. I am the one that gave her the procedure. This is a real thing. He also explained why she had to have a high dosage of ketamine, but Dr. Smith still refused to document anything Dr. Kirkpatrick had even told her. So the hospital would not let Beata talk on the phone with Maya. And so Beata was really looking forward to a court hearing so that she can explain things and this will all be over soon. So on October 14th, they finally had a shelter hearing for Maya at the court. And due to the report from Dr. Smith, the judge sided with the hospital and he ordered a no contact order for Beata and Maya. And that sent Beata over. She just collapsed and she was unresponsive. The they had to call paramedics. The judge put Maya in Children's Services custody and also gave the hospital the okay to change her treatment plan and stop the ketamine infusions. And the hospital didn't tell Maya anything. Maya's at the hospital wondering where her parents are at. The only thing they told Maya was, you can't talk to your parents. The judge also said that Beata had to go get a psychological evaluation. And when she got it done, they found no evidence of Munchausen's by proxy. But they said that she was in a depressed state due to her daughter being taken away from her, which is called adjustment disorder. Duh. But you would think that even with them proving that she doesn't have mental health issues, they would release Maya. They would dismiss this whole thing. Wrong. Even after proving there is nothing wrong with Beata, they still would not let her talk to her daughter on the phone. They only allowed Jack to talk on the phone. And when Jack was able to go visit her, he said Maya looked like she was getting worse and worse. Finally, when Beata was allowed to talk to Maya, it was a lot of rules. They was always listening in, and Maya's caseworker, Catherine, would be sitting right beside her. And so Beata, she wants to know I want to know everything about everybody that's in charge of my baby. And so she looked up Catherine on the internet and found out that Catherine, the caseworker who is calling Beata a child abuser, has been to jail before for child abuse, which those charges was dropped. But that didn't stop Beata from feeling off about this. And Catherine would sit Maya on her lap and say things like, I'm going to adopt you from foster care because your mom is in a mental institution, and would take pictures of Maya after Maya told her no. So imagine this news as a mother. And then on top of that, Dr. Kirkpatrick writes Beata a letter and says, without the ketamine, I understand they're not giving her ketamine. And without it, she's going to die a slow and painful death because of the blood clots in her legs that may go to her lungs. This is devastating news for Beata to find out that if your daughter don't get the treatment that she needs, if they don't release your daughter, that she's going to die, or she just may be dying right now. And Beata's completely helpless. So Maya and now the whole family is suffering. And Maya would call her mom crying, and Beata would always end the conversation with prayer. And she would always end the prayer and say, take care of Maya.
Hi, honey. How are you, sweetie pie?
I'm hurting. I miss you.
I miss you so much, too. I miss you so much every day. Every single day.
You know how happy it makes me feel to hear your voice.
Same here. I miss you so much, and I am so happy that I'm finally able to hear your voice, too. Yeah.
I hope you.
What did you say, sweetie?
I hope I can see you soon.
I would love to see your son. I would love to see your son. We just have to wait for the judge to make the decision, okay? As soon as he makes the decision, then I'll be able to see you.
And the caseworker, Catherine, documented that phone call and said that the mother was just too damaging for Maya, and they are no longer going to allow Beata to talk to Maya on the phone until the court gives more information. So Beata went through all that to have a conversation just for them to pick at the conversation and say, it's best that we just don't do this anymore. To make things even worse, Jack came home and said, I got interviewed by the authorities and they asked if they release Maya, would I keep Maya away from you? And I told them yes. And Beata did not like that because she didn't understand why a husband would go against his wife when they're attacking your wife. I am the victim too. You know, you protect your children. You also protect me. But Jack was just trying to cooperate and answer these trick questions so he can bring his daughter home. On December 15th, Maya wrote the judge a very, very, very heartbreaking letter and said, thank you so much for your time with my case, but all I want for Christmas is to go home. I never got to say goodbye to my mom. I cry a lot, and I pray every day that I can go home and give her a hug. After many meetings, after many court hearings, the judge continued to side with the hospital, despite Maya's letter. And Maya's attorney even requested to the judge during one of the hearings, like, would it be okay can I request that it's just one visit and Maya gives her a hug? Maya just wants to give her a hug. And the judge's cruel response was, I'm afraid not. Nope. So now, strong, resilient, and protective Beata was now devastated and broken. On January 8th, 2017, they were supposed to go to a birthday party. And Beata had a migraine, so she was like, I'm just going to wrap the present and I'm going to send you guys out the door so I can get some rest. But it was permanent rest that she got because in the birthday party, 42-year-old Beata took her own life. So when Jack and Kyle got home, They figured she was still asleep and they left her alone. So they watched TV, and it wasn't until later that night Beata's brother came over, and he randomly is walking around the house. He's going into each room, and he goes into the garage, and that's when he sees his sister hanging. And it's so sad. In the 911 call, you could hear their son Cal crying for his mom.
911, what's the location of your emergency?
From herself.
What's the address? What city are you in?
Venice. Closest road is Lee Road. In Venice.
Is there a name to the neighborhood?
Kyle.
What's the phone number that you're calling from?
I'll give you my cell.
Tell me exactly what happened.
She hung herself in the garage. No.
Stay on the line. Are you with her now?
Well, I'm in the garage.
How old is she?
42.
Is she awake? I just have to verify.
She's stiff. She's stiff. Oh, my God. No, Kyle, you can't go in there.
Okay, tell me why she looks like she's dead.
No, I'm a retired deputy fire chief. I know she is.
Do you think she's beyond any help?
Beyond, yes, rigor. I'm sure she's really
okay.
stiff.
I'm sending I'm sending someone to assist you. Please leave everything as you found it. Is there anything we can do for you?
Okay, just please get somebody here.
They're on their way.
And poor Jack, like, he's so heartbroken, but he has to be strong enough and figure out how is he going to tell Maya. So, of course, Beata left a letter. And in the letter, she told the judge that his heart was made out of iceberg. She also wrote to her son. She said, I love you very much, and I hope you grow old to be a strong, good man and stay close to God. And then she asked her husband to take care of Maya. And Maya never got a hug from her mom. And I wholeheartedly believe that Beata knew they would release Maya if she did that. And she was right. They released Maya and allowed Jack to take her to a specialist in Rhode Island. And the specialist confirmed that she does have CRPS after evaluation. And so the specialist sent those documents to the court, and they released Maya back to Jack on January 13th, 5 days after Beata's passing. So a year later of physical therapy, Maya went from a wheelchair to crutches. Then a year later, she started walking, and she went back to seeing Dr. Patrick without the ketamine. Come to find out, there was so many families in that area who experienced the same cruel behavior from Dr. Smith and the system, who didn't have enough funds for a lawyer to sue, and they're now just traumatized. But thanks to Beata documenting and recording every conversation, and so they had the ability to sue Johns Hopkins Hospital for emotional distress. And the lawyers also found out that Dr. Smith was billing Maya's insurance for CRPS. But that's the same sickness that you said she didn't have. Dr. Smith was telling Maya her mom had made up, and it was all in Maya's head. But you're billing her insurance for that exact same thing that you said she didn't have, and she was abusing her child. So as of today, at the time of this recording, Beata Kowalski is suing Johns Hopkins Children's Hospital for $220 million for emotional distress. Now, I'm going to speak into existence and go ahead and congratulate this family on their settlement. And I want to say rest in peace to Beata. And if you are struggling with self-concept or suicidal thoughts, please call this number. And please remember, you are enough. You are worthy. And if you are not here, someone will have to tell your story for you, but it's going to be a sad ending. You are the best person to tell your own story with a happy ending on how you overcame this. So So to hear more mental health cases, click right here. To subscribe to this channel so that you never miss another video, then click right here. I love you, and we shall talk again in the next episode of Jazzy Times Crime.